Hi everyone, today we're going to be talking about mortality rates among lower income individuals and marginalized communities within the city of Boston. Boston is typically seen as a relatively wealthy and equal city. However, when you look beyond the surface, it becomes apparent that there are significant disparities for both lower income communities and communities of color. Two of the most impacted neighborhoods, Roxbury and Dorchester, both of which are majority communities of color and have lower incomes, have higher premature mortality rates than other neighborhoods in Boston such as Back Bay, Downtown, and Beacon Hill. So what is premature mortality? Premature mortality is death that occurs before the expected or average age of death in a population. According to the National Center for Health Statistics, during 2015 to 2020 combined, the 5 leading causes of premature mortality in the U.S. were unintentional injury, cancer, heart disease, suicide, and infant mortality. Premature deaths are deaths that could have been avoided if people had access to high-quality health care, or if policies and actions for social and economic development have been adopted and put into action, especially those policies focusing on reducing inequality. So what are the factors that cause premature mortality? Social determinants of health, including the conditions and environments where people are born, live, and work, significantly impact mortality. Specifically, income level, educational attainment, employment status, access to social health services, and safe housing are all associated with mortality rates. A growing body of evidence has found that all forms of racism, including structural, institutional, and interpersonal, are all associated with higher mortality and lower life expectancy among people of color compared to white individuals.
There are very evident discrepancies among diverse populations experiencing premature mortality. There is nearly a 33-year disparity between the census tract with the highest life expectancy located in Back Bay at 91.9 years and lowest life expectancy located in Roxbury at 58.9 years from 2003 to 2007. Those located in lower income areas experience nearly 2/3 the life of those in high income areas. The CT with the lowest life expectancy was characterized by lower median household income and a larger proportion of Black and African American residents. Between 2017 and 2021, while there was no significant change among the rate of premature mortality amongst Asian, Latinx, or white residents, Black residents experienced a 37.3% increase in premature mortality. Premature mortality can have significant impacts on families, communities, neighborhoods, and support systems in many ways. Premature mortality within a neighborhood or family can cause emotional distress, economic hardship, social disruption, and a decline in community cohesion. The death of a primary breadwinner can lead to financial strain, impacting the ability to meet basic needs and pushing the family further into poverty, which might further increase the likelihood of another member in the family experiencing similar health disparities. As noted before, there is a disproportionate premature mortality among low-income residents in Boston. Most notable is the nearly 23-year age gap between a census tract in Back Bay, where the life expectancy is 91.6 years, and a census tract in Roxbury, where the life expectancy is 68.8 years. This shows a massive discrimination gap between the citizens of these seemingly close communities. The map shown highlights this statistic.
Common causes of lower life expectancy in Boston include cancer, heart disease, injuries, homicide, and diabetes. For all these factors and more, minority groups are severely affected. For example, from 2017 to 2021, there was no significant change in heart disease mortality rates in Boston. But in 2021, heart disease mortality was 37% higher for Black residents compared with white residents. There are general recommendations when it comes to improving life expectancy. Overall, improving access to health care, promoting healthier lifestyles, addressing environmental factors, and ensuring equitable access to quality housing and nutrition are proven tactics to lessen premature mortality. Increasing life expectancy will require a coordinated effort across levels of government, as well as the private and nonprofit sectors. In Boston specifically, preventative measures have been taken. Boston Public Health Commission created a new long-term health equity agenda to improve life expectancy while reducing racial and ethnic disparities to ensure that all residents can live longer and healthier lives. They also run several additional programs to prevent cardiometabolic health. Additionally, Commission Live Long and Well Health Equity agenda focuses on 3 of the leading causes of premature mortality in Boston.
In retrospect, there is a clear health disparity among lower income and diverse communities in Boston. In lower income areas, such as Roxbury and Dorchester, there is a lower life expectancy for residents, and minority groups are likewise disproportionately affected.